Hey everyone, Dr. C here with you. So here's the idea. I was just chatting with a friend, Dr. Brittany Henderson. She's a conventional endocrinologist, and just thought I'd let you in on a conversation we were having recently and see what you thought about things. So yeah, let me just get her on the phone here if I can catch her. Uh, hey,
Hello.
Brittany. Hey, how you doing?
I'm good. I'm good. How are you?
Good. Yeah, nice to catch up. So, have you heard about this new organization, this American College of Thyroidology?
I don't think so. I mean, American College of Thyroidology. So, no, I don't think I've heard about that. What's that all about?
Well, so I guess it's a group that they're trying to bridge the gap in thyroid care. Like pull together all the disciplines, endocrinologists, naturopaths, chiropractors, health coaches, nutritionists, really combining both of those worlds to make a unified approach to help patients do better.
Wow, that's amazing. Wow, we've been really trying to get that going for so long. I'm so excited about that. I think that everybody coming together and talking through, how we treat thyroid patients and what we do for diet and all of these things are really important. But I don't know, like, how am I going to get my endocrinologist friends to buy into this? They just have been so resistant to opening their minds to new ideas and talking through some of what other people are doing to treat thyroid patients. I don't know. How do you think that's going to work?
Boy, I wonder how that could play out. Hmm.
Hmm.
Oh, wow. I am so thankful I finally got to see you, doctor. I've been wanting to get an appointment for a long time. So I feel horrible. I'm like completely exhausted. I've got like just no energy, gaining weight for no reason. I'm constipated. I can't think straight. My hair is falling out in clumps. I don't have all that much left. Would you look at that? Uh, you know, I'm a
Yeah.
guy, but I really think this is something hormonal. Can you help me?
I mean, you have Hashimoto's disease. Okay. So with that, you just feel bad. You just have to accept it. That's how it is. And you're getting old, really old. Um, and really, with Hashimoto's disease, there's nothing that you can do except for just let your immune system kill your thyroid. There's nothing to check, there's nothing to do, there's no diet, there's nothing you can do with vitamins. And, you just take your Synthroid, and your TSH looks great. I mean, look at this. It's in the normal range. We're fine. I don't know what's wrong except for that you're just getting older. And according to the guidelines, which I follow the guidelines, so here's what I follow, and according to this, you're fine. There's no problem at all. So I think you're obviously overeating and not exercising, and probably clinically depressed. So we could start an antidepressant, but other than that, take your Synthroid and we'll see you back in maybe a year, 2 years. Just don't call me if you have problems because you're fine. It's normal.
Wow. I'm glad the tests are okay, I guess, but I really don't feel good. Okay, here's the truth. So I've been reading stuff online. I've been looking at some websites and they talk about all kinds of things, doctor. They talk about like optimal ranges. They talk about natural treatment options, desiccated thyroid. I mean, what do you think about that stuff?
I have no thoughts about that stuff. That is all poppycock. There's nothing to it. There's no optimal ranges as long as your TSH is in the reference range. That is all that matters. You can't check T4, you can't check T3. What a waste of money. And there's nothing to do with it either. So yeah, no. And then as far as desiccated thyroid, I mean, that is the worst thing you could ever think about doing. It's just horrible. No one could ever be on that medicine. Synthroid only. Synthroid only. Don't ask me about any other medicines.
Oh boy. Well, so truth be told, I was, hoping for some options. I'm thinking about seeing a natural doctor next. So
I'm
could I
sorry.
still,
What? What?
well, yeah. Could I still work with you or?
No, if you're gonna go see a quack like that, Dr. Christianson, there's no way we can work together. I know what your TSH says. It is normal. You're just depressed and middle-aged. There's nothing else to do.
Well, I wonder what things could be like in the natural medicine world. I wonder if they could do a better job for me.
Did I come to the right place? I'm trying to see doctor for my thyroid. Is this right?
This is more than right. This is your chance. You've come to the right place.
Oh my gosh. Well, I'm so glad to be here. I've been seeing like conventional endocrinologists forever, and I've been on Synthroid forever, and it's just not working. Like, I feel horrible. I have brain fog. I can't think clearly. I'm gaining weight. Like, it's just, please help me. Please help me. I hear that you have all the answers.
Oh, completely. And I'm glad you're seeing through the conspiracy because that's all it is. It's a big scam.
Oh,
And they're just out to
wow.
trick you to keep you miserable and yeah, keep you unwell. And it's time to break free from all that.
Well, great. I'm so excited. So what do you suggest that I do differently? Do you think I should go on like a natural desiccated thyroid, or what should I do there instead of the synthroid?
That's just where we start for sure. Yeah. The basic idea is food is your enemy. You should no longer consume pretty much any food. Boy, blueberries, they have these anthocyanins. I don't know if you know this, but those are actually pesticides. Those are like toxic compounds.
Oh,
Uh, you name it, any food you could think of, it's dangerous to your thyroid. So food is just out. And medications. So you can take more and more and more thyroid medication. In fact, the more the better. But you want it to be natural and you want to have just super, super high doses.
but won't I feel really like jittery and like kind of bad if I just keep increasing my dose to oblivion?
Well, if you do get side effects, then you want to take higher and higher doses. And
Oh,
you'll feel so good that the side effects won't even be there anymore.
oh,
And the funny thing is, I hear these crazy doctors say that it's dangerous and that you should, avoid too much. And that's part of the scam. That's just part of what they want to do to keep you down and keep you in the whole system.
I can't believe that they would do that. I can't believe it. Well, I'm so glad that there are people like you in the world. So, okay, so maybe I'll go up on my medicine and we'll start a new one and not eat, what do I do for nutrition? What do I do for my vitamins?
Oh, vitamins aren't a problem. You want to take lots and lots of pills, pretty much all day long. I'll give you
Oh,
a 20-page list of guidelines for the pills to take and when to take them. And yeah, the thyroid medication is just the start. It's pretty much just pills all the way on through. But yeah, just stay away from food, whatever you do.
oh geez. Okay. All right. So all right. And if I need all of these vitamins, should I just keep doing like, is this one good? Is this one like, which ones do you think I should do?
Uh, it's not even a matter of which ones to do. It's just there's almost none not to do. I'll give you a big long list. It'll take all brand new ones. Lots of pills. Stay away from the food. Now the other thing is that you've got to realize that you're not feeling well for a reason. There are many vested powers that have an interest in keeping you down. So yeah,
Oh,
so look out for that stuff. I've got a good deal on some of the tinfoil helmets right now. They're a very important part of your recovery.
oh my gosh. I'd never even like correlated thyroid with the tin foil helmet. What does that do?
Well, the thing is, a lot of people think that it's just a basic way of covering your whole head, but they're not using the most advanced nano quantum forms of tinfoil available. So
Oh,
when you get the right forms, it just takes a small skull cap like this. And a flower is just a reminder to be happy because knowing that you're safe. So yeah, it takes that little. But we've got some of these on special right now. Would you believe these are $9.97, and you can get 997, and we
oh,
can even get 2 packs sent out, and you can start right away.
oh, geez, that's a little steep. What is it? Is it gonna like shield me from like the 5G, or like, like contact aliens, or just does it get nutrition from the sun? Because I'm not allowed to eat. Like, maybe I'm turning into a plant.
Well, now the 5G and the aliens make sense. The distance from the sun, that's just silly. Do you think I'm crazy?
Well, definitely get me one of those spoil hats. I need it immediately. I need to get well. So give me all the pills, give me all the medicine, and just I will be sitting in the sun, pill after pill all day long till I feel better.
So, yeah, that's kind of what we see as going on. And that's kind of what prompted us to come together. So the backstory is that Dr. Henderson has been a renowned thyroidologist, world expert, researcher, clinician, author for quite some time. I've been at this for quite a while. I came across her book not that long ago, and I thought, this is awesome. This is someone who's educated. They see a lot of things that I see. They see the benefits of the natural side, but they see the shortcomings about it as well. And I reached out to her and said, hey, I'd love to have you on my podcast and talk. And so we talked, and I really enjoyed that. And a passion I've had for so long that it's been unfulfilled is a way to really train more practitioners, doctors, practitioners, just across the board. People are always saying, where can I find someone else? Why doesn't my doctor know this? How can we get more help? Who can my sister see in Cleveland? I'm always hearing stuff like that. And so I talked to Dr. Henderson after we did our interview. I said, look, I've had ideas like this, and what do you think? What would you think about doing something to make a difference that way?
And it was so funny because I had the same ideas, to be able to kind of talk to the conventional medicine community who, they have guidelines. Guidelines are guidelines. You still also need to push forward science, and you need to start thinking about the fact that we don't know everything right now, and that obviously if there are millions of people on social media talking about how they feel horrible and nobody is listening to them on their current medicine, then probably there's an issue, that we need to kind of start to look at. And I think that in the conventional medicine world, they're starting to kind of look at this. They're hearing patients. There are so many patient advocacy groups, and I think that's wonderful. It's really kind of turning the tide here. But then, to establish a group that kind of brings together conventional medicine and then integrative side of things, and practitioners from all different walks of life and from all different training backgrounds to come together and actually talk about these issues and talk about the science and talk about their clinical observations and clinical care, and maybe what's wrong with what's done in their world, what's right with what's done in their world, what we can do for future research. That is really what is needed to kind of push the thyroid world forward.
And that's the thing, this data exists. So in some senses, there's a need for new information and better answers, but there's also just a need to make use of the ones that we have available. And there is good information. We've got to get it out more widely. I got to do a brief aside here to some comments. So Melody, Cindy likes the high fashion hat. Melody said that I think, hey, Brittany, so what's the name for your alter ego, the mean strict doctor? Is there a name there?
I didn't think that one through. I didn't know that would be a question. I mean, I'm open to suggestions.
Or I don't know.
Betty Boop? I don't know, Betty.
Well, anyway, in your alter ego, apparently you provided better information than Melody received from her doctor. The traditional doctor said just as a psychologist who referred her to a sinus doctor who treated her for sinus, which was not it at all. So even
not related to the thyroid.
Even when you were trying not to be helpful, you were still more helpful than what Melody was exposed to.
See, that's pretty bad. So, I mean, I think we can all agree that we have done a horrible job, just like in general, for practitioners in general, treating thyroid disease, actually listening to patients, thinking about new ways to do this, that obviously our old conventional ways are not working. And And I knew that. I mean, going into thyroid, I was conventionally trained. I did my fellowship at Duke University. I was in the basic science lab. And then I went over to Wake Forest Baptist in Winston-Salem, North Carolina, and I ran their thyroid program for like 3.5 years. And all I had to do was listen to patients. That's it. That's it. And then, do my own learning on what is going on and what does the literature say. And there's a good amount of literature about some of these topics, about nutrition and about vitamins and about antibodies. And it's just not out there in the conventional world. And it's just poo-pooed, I think, by a lot of physicians that just are not up to date on the latest literature. And it's really a disservice to patients. So if we can fix that, if we can start talking to those people and we can open their minds to new ideas, that is the whole entire purpose of us coming together and starting to train providers of all walks of training on how to help people, on how to help people.
And I think that's just exactly what we see in the conventional world. And, my bias, my side as a naturopathic physician focusing on this, I saw that in the natural medicine world, everyone was plenty open-minded, but sometimes not enough critical thinking. And there is the whole baby with the bathwater. There are some good points about, doing things safely. And thyroid hormones are a big deal. So I want to make sure that in the natural side, with our enthusiasm about trying to manage symptoms, looking at more natural options, that we hold on to some safety. So I think the idea is getting the conventional side to be aware of more options and getting the natural side to be thinking about safe options.
Yeah. And I think that's like the inherent bias with the conventional world against natural desiccated thyroid and against, integrative medicine, because they see these patients who are so overdosed on the medications. And it is not good. I mean, we see people in the hospital with atrial fibrillation and just really sick after this has been going on for so long. And there's a lot of misinformation out there about, that it's okay to be on that much medicine, which I think we both agree that you should be on what you need to be on, and it should be right. So I think that there are many providers that mean well, but maybe just don't know how to dose the medicine correctly.
Mm-hmm. I'm just seeing a lot more comments coming in. So Regina's asking if it's being recorded. It is, Regina, and we will share this. Elisa, treated by symptoms. She went back and forth in natural and synthetic. Many have gone back and forth. So yeah, this is a thing. And we thought too we talked about this for a good year or more about how to roll it out. And we thought about, it really was a labor of love. We wanted to, she's got a busy practice. I've got my things going on, but we wanted to help others do better. And so we thought about how would this whole thing work as a business model. And we thought about it, and it didn't make sense for it to be one. So we built this as a nonprofit organization. So after a lot of paperwork, a lot of proving ourselves to the IRS, we're a 501c3 group. So this is a charity, and we're putting our training out. We are asking for payment for that. And as a charity, that money is tax refundable. The goal for us is to cover the expenses in having the group, but also allow the group to grow. And we can see a time in which the American College of Thyroidology, this group, can fund research, in which we can fund practitioners and help them take the things that they're seeing clinically and convert that into hard data that does influence conventional practice.
And that is where the money is, like really, like, you said that too, but that is how we're going to get these other providers to listen to what we already know clinically, right? So we need to kind of design the research projects, and we need to get the right population of thyroid patients to show the outcomes. And a lot of the research out there is contradictory. It's not conclusive. And that's because the way that it's designed is not proper. So, we're open to new ideas. We really want researchers who have novel ideas. A lot of times, journals won't accept publications unless you follow the guidelines for what you actually designed with the study. Well, why would you do that if you actually wanted to learn more new things about the science of thyroidology. So that is a huge, huge effort that we really want to undertake and be able to fund researchers in basic science and in the clinical settings so that we can really start to have people listen, so that we can help with new drug development. All of those things are so important to bring this to the forefront.
And we believe the organization can do that. It can actually influence practice on a wide scale and change medication, just change this whole course of action. A lot of folks who are coming on. So today is World Thyroid Day. So we've got Thyroid Awareness Month, which is January, and World Thyroid Day, which is like right now. This is May 25th. Those who are here with you live, you're seeing the recording. Well, it'll be World Thyroid Day again soon, but this is the one for now. And to commemorate the day, we wanted to announce the founding and the launching of the American College of Thyroidology. We are at actthyroid.org, and we are a nonprofit organization to train practitioners about better thyroid care. And the general idea is that each month we'll have training modules that will come out for our members. We're creating a forum by which our members can collaborate on cases, share their best practices, and all work together. And ultimately, as Dr. Henderson is saying, fund research, create publications, and start changing the whole scope of practice.
Yeah, and I mean, we're planning lectures for practitioners in all different areas of thyroidology. So surgery and medicine is one, nutrition and diet is another. And then also like patient advocacy, like talking about how it is to be a thyroid patient and what we need to do as providers when we talk to patients, and how can we listen better? How can we actually address some of these concerns and talk through the science when we're giving these lectures to other practitioners who are involved. And then we have an entire patient education tract as well that is free to patients. And we really want patients to be involved because they have been the biggest advocates for change in the thyroid arena. And we hear you. And I think hopefully ACT can fill what you've been wanting, which is better care for thyroid disease. It's your physicians to actually know how to diagnose you correctly and early. And it is your physicians to know how to actually dose titrate and get your antibodies under control, get you on the right diet, get you on the right vitamins, talk about like the underlying root cause of what is activating your immune system and fix it and get your old self back. I mean, fixing it so that people aren't miserable for years and years and years. I think the average time to diagnosis right now is like 7 years, which is ridiculous.
Wow.
It's so crazy.
I'm seeing a lot of comments jumping in. Linda's joining late. How can the recordings afterward? Linda, we'll have those up here on Facebook and on Instagram and on YouTube. They'll be easy to find. Kim is asking about time-restricted eating, Hashimoto's. Kim, yeah, our first module actually has some on that by our nutritionist. And as Brittany, Dr. Henderson was saying, there'll be information that's available for patients freely. We've had a lot of patients ask if they can take the full-on training as well. And you're welcome to. It's again, fully tax deductible. It's a charitable organization. So there's really no cost by doing that. And those who are practitioners also have the option of going through a certification process. Did you want to mention that, Brittany? Or?
Yeah, so we are going to be offering Diplomat of the American College of Thyroidology. So it's DACT, D-A-C-T for short. And so basically every month when we come out with new lecture series, we are going to tag some of those as critical for DACT certification and accreditation. And so you do have to be a provider with, you have to be a provider to go onto the DACT track. You can't be a patient. But basically, doing those specified modules, and then we're going to have tests or quizzes at the end of each of them to make sure that you understand the knowledge presented. And then at the end of completion of the required modules, we're going to have a sit down, test examination that you need to pass in order to get DACT accreditation. And also probably some case studies that are presented that we kind of peer review and talk through just to make sure that that the person getting accredited understands. And then hopefully that would be an indicator for patients that this person, this provider has done additional training in thyroidology, that they're really pursuing knowledge in that area, and that there's somebody that patients might want to go see as a provider that's knowledgeable in the area of thyroid.
You know, Brittany and I have written books, we've gone to medical school, so we understand that some big endeavors take a little while to come into place. But we can see a time in which, in the near future, you can go on actthyroid.org and you can click on find a DACT practitioner in your area. And you can find a doctor, a nutritionist, a mixture of people who can work with you there remotely. But that's the idea. We want to come together and create better guidelines, make them clear, train people in them, and then make these people available and visible.
Absolutely. So yeah, so I'm excited about that. I think that that's going to be a good indicator for people who are taking this seriously and really wanting to learn. And I think there's a big thirst for knowledge among providers. You know, they hear things from patients, you know, they listen to patients, but maybe they don't have time to sit down and actually like go through PubMed and look up all of the articles and all of the science behind why do we prescribe selenium, for example, or why do we talk about gluten and dairy free, or, you know, why do we do these things? What is the science behind that? So the thought behind the lectures is, okay, we're going to take a topic in thyroid, Hashimoto's disease, Graves' disease, thyroid cancer, thyroid nodules, iodine deficiency. We're going to be talking through, you know, case reports and things, and just kind of looking at the science. And in all of the lectures, we're going to have little icons that kind of say, okay, this is a clinical trial. This is something that we really need to look at, or this is basic science research. This is just my clinical opinion, you know, because I've been doing this for a while, or this is something that's out there in social media. Maybe that's not correct, but at least, you know, kind of putting it out there that this is what's out there. And is it true or is it not true? And what's the science behind it? So really, really trying to answer these questions, putting it into a condensed lecture for busy practitioners. We are all busy. We don't have time to like scour the literature for every single topic, but really we put a lot of effort into this so that people can get that information and get accurate information.
Diana is saying no mainstream practitioner has a clue how to treat this other than give you a pill. Yeah, it's kind of what the totally agree. Nancy's saying menopause and trigger Hashimoto's topic I hope doctors will address. Yeah, Nancy, our first level of training, we've got that exact one. We're going through the overlap of female hormones and thyroid disease. Linda's saying just thank you. Others are saying how can they help? What can they do? So the ask is really, we want to help everyone do better. Make your practitioners aware of the American College of Thyroidology. If there's someone you see for your thyroid care, ask them if they are yet a member of ACT, and ask them if they're aware of it. Share this with them. If you do wish more in-depth training on your own, grab all the free training we have. It's now just rolling out today. There's more coming out each month, but grab what there is. As an individual, you can also become a member if you wish and take more training. And we've had many ask how they can donate. And you can also just freely donate. This is a tax-deductible charitable gift. And this is a way in which any frustration you've had about thyroid care being done badly, you can direct that into a way in which we can help others do better.
Absolutely. And if you're a provider listening today, I mean, please, you know, come over to our website, look at what we have to offer. We really, really want to help. That is the main focus. We can't help everyone. Like Alan and I can't see everyone in the whole world. So we really need to be able to train other practitioners on how to do this correctly, how to think about it correctly. And we want to help. I mean, we really do. So we've been thinking about this for a while. We've been meeting weekly for like a year or something, trying to plan for this. And we've been, grabbing other practitioners and other types of medicine. So we have on our board, we have Gary Clayman. He is an MD by training. He's a surgeon, a world-renowned thyroid surgeon down in Florida. And he's involved just as, somebody who knows the surgical approach and the post-operative approach and knows that it's so important for people who've had thyroid surgery to have T4 and T3, so important. And that is not accepted in the conventional endocrine arena. And then we have nutritionists. We have people who are patient advocates. Rachel Hill is on with us as well. We have naturopaths. We want to integrate, pharmacists. We want to integrate chiropractors. We want to integrate everybody who really plays a role in helping, get thyroid patients healthy again. And we want to start talking about it. We want to start talking about the science. We want to identify places that we can actually start doing some research projects in that then we can publish and come into like the conventional medicine world a little bit stronger, so that people start listening to what we know.
So imagine that. Just think about all of us who you are here, and you're airing your frustrations, and you're not alone, and you're validated. We've been big surveys have shown that people are not getting the care they need. But imagine how we could look back a couple of years and think that, just by being here, by sharing this with your practitioner, by donating to support ACT, we could put together some clinical trials. We could find data out about dietary change, about combination therapy. We could do some really high quality studies on that and publish those, and have those be taken seriously by the conventional world, and improve the natural side as well, and have them come together. I think Brittany had the idea of the bridge as an image. And that's the thing, is that we want to pull these worlds together. I mean, you guys as patients, you're tired of being stuck in the center of two parents that won't talk to each other. It's like, it doesn't have to be.
Yeah. And seriously, we both have good ideas and good backgrounds and good training. And in both worlds, there are things that are done well, and there are things that are done horribly wrong. And there are things that are done just mediocre. So I think that people can really benefit from bridging that gap. Let's talk, let's figure this out, and let's just hopefully reach providers in all of the different arenas that are taking care of thyroid patients, so that we can do a better job and really, really help people.
And we spent a lot of time thinking about the name too. And I think the acronym really jumped out to you about ACT. I mean, we're doing things. I mean, we're trying to make it, we're trying to act. And so in the idea of pulling together these worlds, the way we can help that happen is by modeling it. So we're doing that. Like at this moment, we got a naturopath and a conventional doctor. I mean, we're working together. So this is possible.
And it's good. And it's good because this is what we need to see, I think, okay, this is what I think. So a lot of endocrinologists, they follow the guidelines, and the guidelines say, T4 only therapy at all costs. And there's not enough data for anything else. And you just check a TSH and blah, blah, blah. So then just like we did that skit, patients are coming in, they're saying exactly what you just said. And probably everybody on the Facebook feed right now can agree with that. And then the endocrinologist is like, well, nope, it's good. You're depressed, or you need sinus issue, like sinus surgery or something, which
Right.
has nothing to do with what they're talking about. And then the patient goes away and then goes to a different provider, because they're not going to wait 2 years before they come back when they feel so bad. And endocrinologists, I don't even think that they realize that they've lost their thyroid patients because they've done such a bad job. And I think that it's just, they don't know. So if they saw what you see, maybe they would start listening to us.
Michelle said, I'm definitely going to let my PCP know about ACT. She did a fellowship in endocrinology, but she doesn't have a clue.
Good. And I think, the good doctors, the doctors that want more knowledge, that are lifelong learners, they're going to want to know, what is this about? Is it rooted in science, which really we're doing a good job trying to make sure that everything we talk about goes back to the literature, and that we actually present both sides of the coin, what's happening, what is going on in the conventional world, what's going on in the integrative world, and then what does the science say and where do we need to go with that. And one of the first lectures that came out today, I did on TSH, and talking about TSH as a blood test and how important it is to get that reference range correct. So some people say, and this is more in your world, Alan, but like some people say, oh, forget about TSH. You don't even need to worry about it. If it's in the toilet, who cares? Whatever. That's just what it's like. But really, it's a hormone, just like every other hormone. So it should be right too. And if you have a physician or a provider that knows how to dose the medicine, then your TSH should be perfect. Your T4 should be perfect. Your T3 should be perfect. Your reverse T3 should be perfect. Everything should be perfect, and you should feel normal again. So that is possible. That is possible. We do it every day. And so I'm talking in that lecture about the reference range and how much controversy there is, at least in the conventional community, less so in the integrative. I think you guys got it right. You really said, it has to be a lot tighter. But there's a lot of controversy. There's a lot of studies that, don't give a clear answer for what it should be. So I'm talking through that and talking through, what are the assumptions that we make when we talk about TSH and just checking TSH. And I think for physicians, it's going to be eye-opening for, okay, maybe I shouldn't just base this on TSH alone. And for patients, if you want to watch it, I mean, it's a lot of science, but it's good talking points for your conventional physician to talk about, okay, well, these are the assumptions you're making if you're just looking at TSH alone. What do you have to say about that? And a lot of them are not going to know what to say about that. Not that you're trying to cause a fight or something, but you do want to ask them these questions because you're allowed to. This is your health. This is your life. You are your best advocate. And Ellen, we were talking about how we are kind of provider advocates, we are, they're patient advocates, we're provider advocates. We are on your side, guys. We really think you're right. We know you're right. So we want to do that better for you.
Mm-hmm. And it's entirely possible. There can be some differences made. People can do better. Ramon is asking, I would love to get more information. So this is for us non-medical also. So Ramona, there's tons of free data that really is made for the public. The training we're doing is medical ease, so do know that. But if there are those who are eager to pursue and want more in depth, they certainly can. That's an option.
Yeah.
Looking at other comments here. So yeah, there's a doctor I went to who truly wants to help thyroid patients, doesn't know this knowledge needed. I already emailed him about this. Yeah, that's awesome, Joanna. And that's awesome. That's the idea. And we're thinking too, as we get going, we'll have some clear guidelines. So when a doctor does give you grief about something you're asking, you can say, well, really, what about the American College of Thyroidology guidelines on this concept? You can share that with them. And
yeah, I think that's good. But I think even just the grassroots effort of telling your providers about us so that they start to come to the website and learn about what we're talking about and listen to the lectures. And, it has to start somewhere. But at least from my perspective, getting people to listen is the biggest hurdle, just getting attention to listen to what we have to say, and then hopefully being able to impress them with what we have to say so that they maybe change their practice. That is the big hurdle that we're trying to overcome.
So those who are just coming on, that's a great response to mention ACT, Cindy said. Yeah, and Michelle's asking, you are right, it's ACT thyroid. So this is a funny thing, we talked back and forth, it's ACT, and we thought about, so we could have had the URL, American College of Thyroidology. That's pretty long. So then the other question was, would it be ACT Thyroid, or ACT Thyroid? So it's two T's, it's ACT Thyroid.org, and org because it's nonprofit, but that's where it is. We're announcing the formation, and today is the launch of the American College of Thyroidology. So we are now up and running. So we want to take a minute and just at the beginning, give you kind of a humorous take on why we think the thyroid world could be done better. Now we give you a bit of a synopsis. So the group is a nonprofit organization. We're offering thyroid training to all types of practitioners, and we're leading towards certification. One can become a diplomate of the American College of Thyroidology. We're a nonprofit charitable group, and we're up and going. We'll cover whatever more points. Dr. Henderson also has a press release she put together that I think is awesome, and I think it does a great job clearly articulating why we're here, what our goals are. So when the timing makes sense, you can share that with us.
Yeah, absolutely. So I put this together kind of just as a summary of and an announcement of what we're doing here with ACT. And I just opened it with the years 2020 and 2021 have been a challenge for many of us worldwide. For most, struggling through the COVID-19 pandemic has been a time of fear, grief, loss, loneliness, and pain. And for others, social distancing and navigating our newfound reality has allowed time for self-reflection on how to use our talents, knowledge, and precious time to help others. As thyroid experts and practitioners from multiple backgrounds and disciplines, including conventional medicine, which I'm from, naturopathy, complementary medicine, dietetics, patient advocacy, and others, we've joined together as the American College of Thyroidology, or ACT. Our mission is to teach other providers how to improve their management of thyroid disease, thereby allowing thyroid patients to have a chance for recovery, restoration of their health, and the pursuit of symptom-free happiness. An estimated 20 million Americans have some form of thyroid disease, probably way more than that. As providers, we are historically have not done a good job with thyroid treatment or even with diagnosis. In addition to the millions of known thyroid patients, millions more have been silently suffering with thyroid-specific symptoms for years without a clear diagnosis. And currently, on average, it takes about 5 to 7 years of symptoms like fatigue, weight gain, hair loss, and other thyroid symptoms before patients even receive, that they have a thyroid illness. And even when they get a thyroid diagnosis, some patients are not always getting the treatment that they expect and that they deserve. As thyroid providers, we see patients come through our doors with the same storyline day after day. And you can refer to our skit in the beginning. This is what we see. Patients are going to their doctor for help only to be turned away without a formal diagnosis or treatment. They're told to go home and wait for their immune systems to attack and kill a very important endocrine gland in their body, a gland that is, critical for human health. And the question is why? Why is there nothing better for thyroid care? And the answer is that there just isn't any funding at the national or the international level for thyroid research. The research to support proper thyroid diagnosis and care really isn't there yet. And really, we need to be putting our time and resources into the research in this area. As a result, many have sought alternative treatments. They've scoured the internet for success stories and information. They've tried fad diets, cleanses, vitamins. They've worked tirelessly to self-treat their own thyroid disease. And over the past decade, there's been such an outpouring of human emotion and an outcry for providers to do better and to show up for their thyroid patients that thyroid practitioners now have started to listen. To date, millions of thyroid patients have joined online social media groups in an effort to share success stories and offer advice. From this public advocacy outcry, ACT has formed, and it's advocating for a new multidisciplinary approach to thyroid care, one that doesn't just include conventional medicines, but also includes a host of other disciplines, from naturopaths to chiropractors to acupuncturists to dietitians, all working towards one goal, and that is to help patients with thyroid disease get their lives back. As the American College of Thyroidology, we are practitioners of all disciplines coming together under one mission. We can do better for people struggling with thyroid illness. We are provider advocates with a progressive vision of how thyroid care should be delivered, and are proponents of new scientific research endeavors with the hopes of discovering novel therapeutics and treatment options. As thyroid-specific practitioners, we know that patients can and do recover from thyroid illness. We believe that the best path to recovery combines both conventional and lifestyle medicine in one unified approach. We believe that personalized patient care should be driven by both scientific evidence and clinical experience. And as the American College of Thyroidology, we plan to educate and train the next generation of thyroid leaders to help us attain this mission. Through ACT, we will be providing resources, education, research support, and information to the brave men and women at the front lines of thyroid care in all disciplines. And how can you help us attain the mission? So if you're a patient, please spread the word on social media, engage your own thyroid practitioner in the cause. ACT offers free educational material to patients and family and friends. If you're a provider taking care of thyroid patients, ACT with us by joining as a member. So you can start by visiting our website, which is www.actthyroid.org. New educational material is available monthly. It launches today, and additional lectures and videos will be released to members on an ongoing basis. If you're a philanthropist, please consider donating to ACT. It's a 501c3 organization. Specifically, funds will be used to reach physicians and other provider groups, keep the organization running efficiently, and support new thyroid research and medicine development. We're just getting started. There's so much more to do. And as we grow, we plan to reach more people in different ways. A few plans include sponsorship of clinical research and the creation of an open access medical journal that will be available to everyone free of charge, and we'll be able to get the information out there to multiple providers in different disciplines. We can make things better for those with thyroid disease and bridge the gap in thyroid care. And after the year that we've had with COVID-19, we all realize that time is precious, that helping people struggling with thyroid illness is important. The future is bright, and there's hope for a new tomorrow for thyroid patients. And please join us. Let's act together and really make it a better world, and a better, thyroid care for everyone.
That's incredible. I can't think of anything to possibly say after that.
Well, I mean, we can end on that note, but I'm thankful for everybody who's joined to listen tonight. It shows how much you care as patients, and thank you for your support, because that we do meet a lot of resistance from other providers who don't agree with what we think. And we're just hoping that we can get the education and the information out to people who are open-minded and who start to think, okay, maybe we're not doing this correctly, so that we can change it for everybody.
I'm seeing tons of thank yous here. Just got to share, how much she obviously has understood this, and how much she really is caring for the patients and getting what's understanding what's happening. So yeah, this is great. Lots of good things coming in. So. All right, I'm really excited. Today's the day. You said it all very well. So let's act together. Let's make it happen.
Yeah, let's celebrate. This is a new future for patients with thyroid disease. I think we can really change it. And so happy World Thyroid Day to everybody listening, and to everyone who will listen afterwards. Thank you for your support. Thank you for going to our website, actthyroid.org, and for considering, joining as a patient, or telling your provider for us, or if you're a provider, for joining and learning. And then also, considering donating to our cause so that we can keep this going for people.
All right, thanks everyone for coming. Brittany, good to see you, and nice to see your alter ego briefly.
Let me put on my alter ego hat here. And my glasses.
All right, everyone. Let's have a good time. Let's feel better. Let's make a difference. Have a good night.